Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place where we bring you the best doctors in their niche and in their area. Today, we're going to be speaking with Dr. Bonnie Kragel. She's out of the Northwest Arkansas area. So if you guys are in the Northwest Arkansas area, we have an up and rising doctor in the area. And today, we're going to be talking about sinus and acupuncture, why they go together. And I like this because, to be honest with you guys, I've never had a good conversation about this. And if you guys know about sinuses, I've been having getting hit with sinuses the last couple days, and I'm trying some stuff that's not working. Maybe we'll get some answers today. Thank you, Doctor Bonnie, for being.
Absolutely. Thank you for having me.
Of course, tell us about yourself, how you got into acupuncture, and just how you got into what you're doing right now.
Yeah. So I, growing up, saw a chiropractor previous to seeing the chiropractor. I was always sick. Allergies of everything. And where we live in this region, it's just a common thing for people to struggle with allergies. So, it's normalized. And so I had hurt my back in a volleyball injury, and my mom was like, "Okay, fine, I'll take you to my chiropractor." And so she did, but not only did that obviously help my injury, I started noticing that I wasn't getting sick all the time, and I wasn't having to take a over the counter allergy medication every single day
Mhm.
just to survive. And so in the back of my head, I was like, "Man, there's something to this, but I'm not quite sure what it is." So fast forward, I always knew that I wanted to be a doctor, but I wanted to be a doctor that truly helped people get better and not just put a Band-Aid on their symptoms. So eventually it was one of the things like chiropractic truly found me. And in that, I knew that acupuncture could be an amazing added benefit to chiropractic care. So I knew from the start of chiropractic school that acupuncture was something that I was going to also offer in my office because I know that hand in hand, they work beautifully together. So
Wow. When the first time that you tried acupuncture, how was that? And what did you experience?
instant relief, truly. It was just like my whole nervous system could take a breath, and it was just like everything was lighter, which is very odd. But it was just like instant, like a deep breath. So for my
Wow.
nervous system. So I was just like, this is really cool. And I want to do this.
Wow. Does acupuncture help out with, like, let's say, like how certain people have tight backs or tight lower back. Does that help with releasing that pressure?
Absolutely. So it can help with anything and everything. And so, yes, we see it releasing pressure in the pain spectrum and the releasing muscles and helping them breathe. But I am a very traditional acupuncturist. So, like, when we put needles in, we leave them alone and we let the body just do what it needs to do with those needles. So, there's sometimes that I'll go in and the body has gotten rid of needles and they're no longer in anymore. They've sometimes twisted and turned and fell over and all kinds of things. So I just very much put them in and then let that individual's innate intelligence do what it knows and it needs
Mhm.
to do to heal.
Wow. So, are have you ever tried to put a needle in somebody and you couldn't?
I have actually put one in and it immediately came back out. And I was like, we're
Hmm.
going to try that again. So we did. And 5 minutes later, it came out. And I was like, I guess we just don't want it there. And I have multiple patients that we do a lot of the same, like, so each patient, typically I put the same points in them every time to work on what we're working on. And I have a couple patients that every single time one specific needle will come out. And it's just the craziest thing to me. So I don't know. We're still
I
trying to
bet I bet you're like, wow, I didn't see that one coming.
Right.
I
Right.
didn't see that one in the textbooks or hands-on in chiropractic school.
Yeah. Yeah. So
Oh,
it's
wow.
so cool. It's so cool what it does.
How long has needling been going on?
It's ancient Chinese medicine, so it's been hundreds and hundreds and hundreds of years.
You know what's interesting? I would get migraines. I mean, I'm 49, so I was getting migraines for half my life. And I mean, to the point where it was so bad where I would vomit at least once a month, sometimes twice a month. and I felt like nobody could help me. And I went to go see this guy in California, and he did Chinese medicine.
Mhm.
And you know what's weird is that it's probably been about 7 years, maybe, maybe two migraines.
Wow.
He did some Chinese medicine stuff on me and I put under my tongue and then I don't know, some voodoo stuff, but it worked. You don't care when you're in pain, but yeah, no. And he did a little bit of acupuncture too. And so I don't know, it just works. So you were mentioning that, when we first started talking that about how sinuses and acupuncture, like why they go together. I
Mhm.
mean, sinus acupuncture, I don't understand how they go together. So if you can maybe kind of talk to us about the specifics on it, that'd be
So we have some specific sinus and allergy points that we use.
great.
And really acupuncture is about energy in the body. It's about leveling out the energy throughout our whole system.
Okay.
And so typically we find that if people are very congested or having sinus pressure, allergy symptoms, whatever it might be, that there's a lot of inflammation, one, but just pressure up here. So we put needles here and then I put needles in the legs and the feet as well to help draw that energy down to help it balance throughout the whole body. And 9 times out of 10, I'll go in to pull the needles and patients are like, I already feel better. Like it's already draining. I can already breathe out of my nose again. And it's just, I'm like, I know. It's amazing. I know. And how it works, like, there's a science behind it. And yes, but it's truly one of those things like it just works. So yeah, it's
Wow. So you put it here and then you put it on the legs.
yeah. So I put a needle right in between the eyebrows. I put some on beside the noses, top of head, in the ears, and then I put a couple in the legs and feet just to give the energy somewhere to draw to, like a full body circuit. And then in
Oh
my
wow.
office, they lay with needles in for 20 minutes, and I in a nice calm room, they can have the lamps out if they want, healing music on, and most people take a nap. So
How long does it take?
it's
Like to hmm
different for everyone. It really just depends on how long they've been dealing with it, how it flared they are, that kind of thing. Some people get results after one visit, which is really cool. Some people it takes
hmm
2, 4, or 5. So it really just depends on that patient specifically, but I do combine it with chiropractic care because first and foremost, chiropractic is number 1.
hmm
And I do have some amazing supplements that I'll send some people home with, and I'm like, "This is gonna get us over that edge quicker." And then we just do maintenance after that.
So do you recommend like once you start, so like with chiropractic care,
Mhm,
everyone's different, some are
mhm.
once a week, some are once a month. Do you do like a plan normally with people where there's consistency so you can keep that blood flowing in those certain areas that start to get kind of like clogged up?
Yes and no. It really just depends. Some people do need maintenance care and they might be every couple of weeks, but some people are like, "I am great," and they haven't come back, and so then I just put them under chiropractic care, and then they are on, like, a maintenance chiropractic care,
hmm
and then if they come in one day and we're flared or I'm like, "Hey, let's do needles today. I think it's time for us to have a little bit of a reset." So,
Okay.
it's a very much a we listen to the body in my office, and we do what it's telling us it needs, and, so yeah, it's so patient specific, but I would say most people, after we get them really calmed down and truly healing,
hmm
they don't need much of the maintenance for this.
Okay. And tell me maybe some stories. I'm sure you've got a few where you've worked with somebody and they said, "Oh my gosh, I don't struggle with this anymore," or "I don't struggle with this." Like, and you're like, "Wow, okay, I didn't see that coming." Or
Mhm.
have you had any of those curveballs? Like, wow,
Yeah,
I
I
can't
have some
explain
pretty
that.
yeah, I have some pretty cool stories. So one of mine, I this one came she's been coming in for a while. We're on maintenance and she on one of her re-exam paperwork, she just said, like, "I've never been able to breathe out of my nose my entire life. I am in my 30s, and I've never been able to breathe out of my nose, and now I can." And I was just like, "Oh my gosh, like, that is incredible." And
You didn't know how to explain that, did you? You're like,
no, I was like, "It works, like, it just works." And so I was like, "Well, that's really cool, like, I'm really happy for you." And so that was really cool because 'cause I'm like, "I can't even imagine never being able to breathe out of my nose, ever." And to me, something that's simple but not, so simple that could just help that for her, and this has been months, and for months now, we haven't done acupuncture, and she's still like, "I'm great. I can breathe out of my nose. I don't get flared up when I walk outside and start sneezing. I don't have to not go outside and play with my kids anymore because I know I'm gonna suffer for 3 days." And I'm just like, "That's incredible." So then I had another one that came in, and he also came in for allergy stuff, and he's in a band, and he's a singer on the side. And he came in one day and he's like, "Hey, I need to tell you something." And I was like, "Okay, what's up?" And he said, "Well, I want you to know that after starting care with you and now that I can, breathe, I can hit higher notes that I have never been able to hit before when singing without straining." And I was like, "That's cool." So, those are 2 of my, like, big cool ones.
So, did you get those on video?
Unfortunately, no. Unfortunately,
Yeah,
no.
we gotta start getting these testimonials on videos
Yeah.
because that's your calling. That's your calling card. And
Yeah.
so, how long have you been in practice so far? And
So, I opened in September
no
of last
way.
year. Yeah.
Dang. Okay.
So we're going on what, 8 months now, and
Wow.
it's been it's been so fun to just see lives changing, like, every single day, and I really try not to take it for granted because, when you see these miracles happening, quote, unquote "miracles," I call them miracles because the body's
Those
amazing.
are those are miracles.
And when you see those happening every day, it's like that just becomes the new normal. So I try really, really hard to appreciate every single one every day and just be like, that was a really cool one today. Or
Mm.
I'm so grateful that this person is having this experience. But yeah, it's been really cool to help people that thought that this was just something that they always had to live with because of where we live and because of we have 4 of seasons in a day sometimes, so it's just that has
Wow.
been really cool, especially the adult population that have been living with this for their entire life. Mm.
I love your passion, and
Oh,
I
thank
I
you.
can just tell you just bring all that energy and love on them, and they're like, "Wow." I mean, I can just see. I mean, I haven't even met you, but I can
Uh-huh.
feel that over just the electricity
Well,
on
thank
on the podcast. I love it. So let's talk about what's it trips me out because you think a needle going inside you. Are these
Mhm.
certain types of needles, or are these like the type of needles that you could sew something? I don't know.
There are certain types of needles. I should have had grabbed one. They're actually this long, they're teeny
Hmm.
tiny, and
Uh-huh.
they're no thicker than a strand of hair. So,
No
like,
way.
yeah, so you really I don't this.
Yeah,
That's
yeah, yeah.
And, I put so many in a day that I'm, like, going cross-eyed trying to put them in my tube to put them in, but they're so tiny, and most people are like, "Well, that would hurt. Like, this is gonna hurt because it's needles going inside of me." 9 times out of 10, you really can't even feel them going in. Sometimes they do sting a little when they go in, but I always tell people, I'm like, "If they keep stinging, let me know, because that means that I need to mess with them a little bit or pull them,
Mhm.
because I'm not gonna make you lay here for 20 minutes with a needle that's stinging you." Like, that's crazy.
Right, exactly. Like getting stung
So
by a bee.
right, exactly, right, that's not comfortable. So,
Yeah.
most of the time you can't feel them. If you do, it's just for a split second, and then when I pull them, it's really cool when I go in to see if they're in a different direction or are they still in, and sometimes
Mm.
they bleed, sometimes they'll have a little red ring around it, and I'm like,
Right.
"We got some good energy on this one today, like, this one was
Oh,
good." But what's really cool is when you go to pull them and the body isn't ready. And you can see the skin, like, come with it, and it, like, resists you a little bit, and I'm like, "That one is really happy right there." So
so
then
you
I know
leave it alone.
that
Do you leave it alone if
it
it's
depends on the situation. Sometimes I'll leave it and I'll pull the other ones, and then I'll go back to it and let it know, like, "We've gotta go now." Sometimes if I have some more time, I'm like, "Hey, do you wanna lay here for 5 more minutes? I'll be back." It really just depends on the situation, but then I
I
know we need to do that one next time too. Yeah.
energizes them? Is that something the same or is it totally different?
It's just a different type of practicing acupuncture. There's
Or
nothing it's
frequency?
more frequency. A lot of people do that if it's more of like an injury based and we're trying to heal like a shoulder or a knee or something. I personally don't do that in my office, but I do a lot more full body acupuncture than really targeted areas. But
Wow.
yeah,
So
it's also
what
very cool.
what are what are like maybe tell our audience like if they're struggling with this and
Mhm.
this and this, just maybe give like a nice list of areas maybe that so that people can kind of know, oh, that's what I can go in and see you. You know, what are the a list of things that you see people struggling with and that you're helping? And yeah,
That's hard. So obviously the sinus allergy stuff. I do a lot of TMJ work. A lot of people that struggle with TMJ pain, headaches, brain fog, dizziness. We see a lot of
brain
that
fog.
with
Mhm.
this. Yeah, that's a pretty cool story. But I typically do. I have the general like pain patients. Yes,
Yeah.
because of my it's who I am. I'm a chiropractor. But my favorite cases and more of my cases are the harder, more like true wellness cases of I've been struggling and I can't think straight and I haven't slept for 5 days,
Oh,
or I can't yawn because my jaw hurts so bad, or I also do a lot of people I also have a lot of people that have digestive issues, so we do a lot of stomach work and a lot of work on that, and we've had great results with people that are like, "I have never felt so good." I actually had a patient the other day, he was like, "I'm gonna need my stomach to not feel this good because now I'm just eating a lot of junk." And I was like, "Well, I don't know what to tell you there."
you're all okay. Number one, I can help you. Number two, you gotta, how many Twinkies are you eating a day?
Right.
We gotta work
Right,
on that. Okay. I can
right.
help you, but help me help you.
Yeah,
Okay.
yeah.
So what other like so how about people with migraines? Does this help out with migraines and stuff like that?
Mhm, mhm. Yep, so we typically put my migraine people, we put on chiropractic and acupuncture. With those points, we do a bunch of just general whole body nervous system reset points, but also in the head and in the
Mhm.
face as well.
Wow. I'm still kind of like tripping on like how you can help out with sinuses.
Mhm.
I never really thought about that. It makes me actually want to go out down the street and go find somebody and go stick some needles in
You
me
should. You should.
just for kicks and giggles because like I
Right,
know
just to
that
test it out.
I mean I play a lot of pickleball and of course I'm getting older so I'm still playing like I'm 19 because I feel like I'm 19. I
Right.
keep telling my body you're 19, stop playing, stop messing with me, okay? You're 19, buddy. And it's funny because my son's 19 and he's whooping me on the court, but I'm giving him some a challenge. And I'm over here looking at maybe I can get some testosterone, some peptides, and I'm gonna go take care of this young buck. No, I'm not joking because the other day I was playing. There was this guy who was like 65, no joke. He was playing like he was 20.
Wow.
No. And I looked at him, I go, you're taking peptides and testosterone, huh? He just looked at me and then he went back to playing. Didn't say nothing. He didn't want all the other old people to know what's going
Know
on.
his secret, right?
No. Oh no, he does. Trust me. But so what would you say if somebody is on the fence and they're scared because it's a needle? I mean, you
Mhm.
know what I mean? What would you say to people like that?
Just try it. If you hate it, you don't have to do it again. Or if we put them in and you're like, "Okay, absolutely not, I'm not doing this," we can take them right back out. Like, it's not a
Have you ever had somebody like that?
no. I've had people that were scared and that were hesitant. A couple of my younger, I would say kiddos, they're in high school age. They were like, "I'm scared, it's needles." I'm like, "I get it. I don't like needles either." But afterwards, they're like, "That was amazing. Like, I'm so glad that I did this." Everyone has always been, "I'm so glad I did this," and there's never been somebody that was like, "No, thanks." So,
You're right.
yeah.
If somebody said to me, "Well, I'm not going to try the needle. I don't like needles." I go, it's a needle, but it's not.
Right.
It's a small little
Yep.
needle. It's not the kind that you see at the store. So
Right.
I'm thinking of the needles that you like croquet with, do crochet and stuff like that. So I'm like, shoot. But I've been hearing so many testimonials on people getting better with this. It's interesting how you were saying when we first opened up, how when with sinuses, you do it here in the middle of the forehead and then
Mhm,
you do it on the legs. And
mhm,
the thing that I keep thinking is they're connecting. There's some way somehow they're connecting. The
mhm,
energy is flowing from the top to the bottom. Is that am I saying that
mhm.
correctly?
Absolutely.
Yeah. Wow. So okay. So when you talk to people about acupuncture, what's their normal reaction?
I'd say it's about 50-50. I have some people that come in already wanting acupuncture, and then I have some people that come in and I'm like, "Okay, look, yes, chiropractic is gonna help you, but I think if we add acupuncture into this, you are gonna just have much better and probably quicker results." And some people are like, "I'm open to trying it," and others are like, "I'm not really interested." And I'm like, "Okay, that's fine." typically, then they eventually ask me a couple of visits later, like, "What about this acupuncture?" So then we try it, and they all love it, and then most people are like, "Yeah, I'm really glad that I did try that because it is helping me a ton." I'm like, "I know."
Wow. So I love your slogan. It just works. I
Thank you.
mean, that's perfect. I mean, I'd be using that on everything,
Mhm,
social media, everything, because now correct me if I'm wrong, because I'm wrong a
mhm,
lot, but when I'm right, I stick with it. So the reason why you do chiropractic first
mhm,
is because not only is it the subluxation part of getting the spine loose so that the blood flow is flowing. So once
mhm.
that blood flow is flowing, you're able to not you manipulate it, but the needles are able to keep the blood flowing and flowing better and longer because if you can get chiropractic, but that's one piece, right? So you recommend both for total to see results. Is that what I hear you saying?
Yes and no. So,
Mm,
I recommend it more for especially with the sinus and allergy people because it helps them so much quicker and
okay. Okay.
for longer lasting, and we could just do acupuncture, of course, like, just acupuncture, we're gonna get results, but to me, if I'm not getting because I am a chiropractic practor first, and chiropractic is most important, if we ignore that side of it and we don't fix the subluxation patterns and we don't get the joints moving properly, then to me, acupuncture is kind of just like a Band-Aid at that point because it's going to help, but it's gonna come back. Whereas
Okay.
if we can fix the problem inside the spine so that brain and body can communicate better,
Mm.
brain and body can then start healing better, which then acupuncture can come in and really speed up that process for us.
So does acupuncture, again, I'm not sure, but I'm just going to ask these questions, but does acupuncture activate the cells that aren't doing well, where they're inflamed? Does it maybe, I don't know.
I would say yes, there's probably some bit of that to it. It's more about balancing out the energy throughout the body. So, yeah, it would be activating what needs activated and decreasing activity on ones that are too much.
There had to be a reason. Like, I understand how acupuncture helped you and you liked it.
Mhm.
But when they were teaching it in class, were there some things that they talked about on how acupuncture helped certain things that just didn't make sense to you, but it worked? Like some cool stories or
Because
like,
I've been in the chiropractic world since before I started school. So to me, like, there's no limits to what this can help and these stories that can happen. So it's one of those like, wow, that's amazing. That's so cool. But it's never like a question of how does that happen? It's just like
okay.
I kind of expect miracles to happen.
Wow. I love that. You're like, I'm speaking life. We're gonna
Yes.
see something's gonna change today that you're gonna
Mhm.
notice. And then they're like, they probably came in negative, not like, yeah, that's what I'm talking about. Yeah,
Mhm.
we're gonna see something. And I think it has a lot to do. It's a two-part. You provide the assistance, but then it also they need to come in with, I'm gonna get better
Mhm.
because we don't realize how much we signal the brain. Like if I keep saying, "Oh, I'm in pain," or "I'm never going to get out of pain," now I'm speaking death over me.
Mhm.
I'm speaking pain over myself. So
Mhm.
I believe that words have a lot to do, and the people that you connect with. I don't like for me. I'd love to come see you right now, but and then I saw the other guy who's all grumpy. I'm like, dude, you ain't gonna touch my back with a 10-foot pole because I don't want that negative transfer. I'm not trying to get all new agey, but it's just that's what it is. We're
It's
energy.
energy. Mhm.
You can't fight it. What you can't use it. What you're going to use another word? Flowing. I mean, come on, no, we're energy.
Yeah.
Wow. So with acupuncture, now it's kind of got my brain thinking a little bit. Like I'm curious, what other things that acupuncture can do? It's almost like we're kind of coming back to it because
Yeah.
it's been around for so long. And
Forever.
yeah, and I'm seeing a lot of doctors that are getting on the acupuncture thing now, and they're like, "Wow, this is something that needs to be done." This is probably I'm gonna go a little bit throw a frisbee out there, but
Okay.
how about somebody with neuropathy? Wouldn't that kind of maybe help some with like say like type of neuropathy?
It absolutely can. It absolutely can. Yeah, it can help with obviously the whole pain cycle. It can help with the neuropathy. It helps with insomnia, it can help with anxiety, it can help with
Oh,
hormones, it can help with fertility, it can help
no
with
way.
inducing labor. There have been stories of it flipping babies that are breech. Like, it's
Wow.
the options and the possibilities are endless in what acupuncture can do. It's just the limiting factor is what the person receiving its body allows it to do. So, like, yes,
I
we
like
can
that.
see these miracles, and yes, we can have these amazing stories, and then I can do the exact same protocol on somebody else that's struggling with the exact same thing and
Wow.
get complete different results, or it take longer, or they
I
don't
love
get
it.
as much, but, like, it's just it's all about what their innate allows.
Mm, I
And
love it.
one of my favorite chiropractic quotes is actually, "The power that made the body heals the body. It doesn't happen any other way." But it's one of those that, like, the power that made the body can heal the body, and it's not
Mm,
up to me or the provider to determine how much better you
wow.
get. It's up to your body's healing potential to do that.
Because the body was created to heal, the way that the nervous system, the way the spine, it's so interesting. I've probably had over 300 shows in the past 7 years, and I love the way you explained it. And I've never had anybody explain it the way you explain it and the stories you have. But one of the things that really got me intrigued, Dr. Palmer, I mean, he was doing an adjustment to a guy, and the guy was deaf
Mhm.
and he
Right.
could hear. I
Mhm.
mean, that tells me I feel like we're behind. And
Absolutely.
we're not. We are, but we're not. It's like a yes and a no. And I don't like yes and
Mhm.
no's. I just like to have a yes or a no. But it's like we're a little behind because what else are we missing?
Mhm.
Because there are a lot of things that people struggle with that I believe that chiropractic is the cutting edge. And we're only getting 10% of the population.
It's heartbreaking.
10%. No, it's
Heartbreaking.
irritating. I mean, so many people that go to the doctor's office, and I'm not trying to be mean to the doctors because there's some really good doctors,
There are,
but
absolutely.
yeah, 100%, but a lot of them just really need a good adjustment. You know what I mean? I mean, but I know that chiropractic is making a major dent because I love what you do
Thank you.
and love your passion. And we need more people like you,
Well, thank you.
especially young, vibrant people. I
Thank
mean,
you.
guys, come see Dr. Bonnie. She is great.
Yeah, so my Instagram is alignchiro_, and with
Yeah,
that
it works.
it just works.
I love that. It gives hope to people, and people need hope these days. And I just want to say again, thank you so much. It was an honor to have you on the show. And people, get off the fence. You don't have to always be in pain. And guess what? If you said, I've tried this and I've tried that, and you haven't tried this, you haven't tried everything. One thing is when you do come in, guys or gals, come in with a positive attitude. Leave the junk in the trunk, leave the stinking thinking in the trash can. And remember, change your thinking and your life will start to change because when you're being positive, you're going to start bringing these positive people towards you to help you guys. And you don't have to be in pain. Sinus people, it just works. Come see Dr. Bonnie. Again, thank you so much for being
Thank
here.
you.
And I look forward to seeing you grow in the next few years and beyond.
Thanks, Mark. It's been a pleasure.
Hey, it's been a pleasure, and I can tell it we'll probably do this again. Have a great day and God bless you.
Thank you. You too.